Diabetes is one of the most commonly encountered lifestyle diseases in Indian community and for that matter world over. But World Health Organization has predicted, looking at the population profile of Indians, that by 2025, India will have the highest number of diabetics in the world. There are so many myths which are associated with diabetes. One of them centers around diet. What diet should these people eat? I am from North India and I can live only on chapatis. Roti is my main, or wheat is my main staple diet. How can I live on rice? And then you'll have a South Indian who says, I eat sambar, rasam, thair sadam and sambar rice every day, and how can I have chapati? So what is the secret? Is chapati good or is rice good? The simple answer is, you have to eat less carbohydrate for your sugars to get under good control. So if you start on that premise that you'll have to lessen the carbohydrate, if you are a South Indian who all your life has been enjoying the traditional rice-based meals, we shift you to wheat-based meal, whether it is wheat rava or just wheat flour, chapati or whatever, to make sure that something which is not used to your body, you tend to eat less, you tend to probably not even like it, and therefore if I shift you to that, the amount of sugar which is released into your system is slower and probably lesser, and that is the secret. So if you are a South Indian, I will say replace your dinner with chapati, which you are not accustomed to. Similarly, if I get a North Indian patient who has been used to eating 3 to 5 chapatis every day, morning, afternoon, evening, one of the meals I will convert it to rice, because that is not something which he is used to. Therefore, his caloric intake or his glycemic index will likely to change, and hopefully he'll have better sugar controls. Apart from that, there is nothing to really choose between chapati and rice. Both are equally good. You need carbohydrates. Second point is, all diabetics, or in general all of us should remember, is that you need certain amount of protein. You may slightly increase it if you want to reduce the carbohydrates and still have some calories for your daily life. The third myth is about protein. That is source of protein. People think that only non-vegetarian food will give you protein, which is not really correct. There are very good vegetarian sources of protein. Out of the different types of pulses which are available, you try to go for green gram. Moong dal has got highest protein per unit weight, and that will definitely help you in planning your diet. So if you actually take dal chawal, it has got enough amino acids, enough carbohydrate and enough protein. The next myth which is associated with food in diabetes is fat. People say, I want to go for zero fat diet. It's not really needed. Fats are needed, and therefore you just have a very small amount of fat in your diet. Apart from what goes on into your cooking, you may have just a bit of ghee. It is actually not forbidden, and it will help you in absorbing the vitamins which are soluble in fat, or what we call as the fat soluble vitamins, and it will also help you reset your metabolism, and therefore take less carbohydrate, take at least 1 gram per kilogram of your weight of protein, and say 10 to 15% of your caloric requirement must come from fats. So that is how you balance out. In addition, try to have portions of vegetables and fruits. So World Health Organization also says that you should have 4 to 5 servings of vegetables and fruits per day. So don't think that non-vegetarian food is the only source. It is highly advisable that you give up your non-vegetarian food as much as possible, and with that your caloric intake will come down, your cholesterol will come down, and so many other preventable diseases secondary to non-vegetarian food will come down. So stay healthy, eat vegetarian food, and make sure that you take adequate and balanced vitamins, fats, and also carbohydrates. Don't stop with just zero carb diet. Don't go for all those fancy words. Have a balanced diet and make sure that your food includes vegetables and fruits on a regular basis. You will have absolutely good metabolism, good fiber in your body, and good diabetes control. So diet is very important, and therefore there is nothing really to choose between chapati and rice. Just stick to the secrets which I told you and you'll be fine. Don't forget to have regular exercise and have in general less number of calories, we all tend to have more number of calories than what we actually expend, and therefore all of us will go into calorie surplus and become obese and put on weight. Especially those people who are on insulin. It is the only anabolic hormone which the human system knows, and therefore you definitely tend to put on weight if you are on insulin. That's the reason why you'll have to check with your endocrinologist and try to actually make sure that you're not putting on weight, and then also alter the food content. Don't try to do it yourself. All hospitals have qualified dietitians whose full-time job is to look at this, take a diet diary chart, and then tell you what are all the things which are best suited for your profile. And if you actually understand that and implement that, it is very useful for you to control your diabetes, control your cholesterol, and hopefully prevent coronary artery disease and sudden death.